Okay. Okay, now, so we have Alzheimer's, right? So if you turn, you should have 5 A's of Alzheimer's. I always add more A's. So of course, if I got 9 A's up here, I'm adding at least 4 more. And what I want you to do is I want you to put an A for Aricept. You do have a handout for this, you don't have to turn because I'm just mentioning it. Because this is the #1 medication, Aricept. We give this out like M&Ms. In other words, you don't need any crazy formal testing. You just need pretty convincing information from family and patient that this might improve their memory. This may improve the ability to do activities of daily living. It is very common. Most of you have given it out as a student. And again, it's for Alzheimer's, but remember, Alzheimer's is only able to be diagnosed on autopsy. You can't really technically diagnose it, you can only work it up, because it's only really diagnosed on autopsy. Okay, that's why a lot of the guys that play football dedicate their brains after they die, so they can have an evaluation of it, since they have similar symptoms. Okay, so you have your Aricept. You also want to add the A for amyloid plaques. Amyloid plaques are basically sticky plaques of almost like cholesterol or something in the brain. So we call it tangles, plaques and tangles. Remember that? That's what we're going to see on MRI. Plaques and tangles. And so when the patient gets a workup, you're going to see these amyloid plaques in the brain. The problem is we've seen amyloid plaques in people's brains that weren't Alzheimer's. But typically there's no Alzheimer's without amyloid plaques. So we could say that almost every single Alzheimer's patient will have amyloid plaques, but not all amyloid plaques will become Alzheimer's. That's why we say it's not diagnostic. Okay? All right, then we know we're going to have an issue with acetylcholine. So the medications that we give this patient are going to work on this acetylcholine. Okay. So Exelon is directly working on decreasing the acetylcholine. The last A is Amy-Vid, which is the testing that we do with a PET scan. Amy-Vid is new in the last 5 years. We have a dye that we use now, and we use this Amy-Vid, which means video of amyloid plaques. Video under PET scan. Remember with the PET scan, we give you sugar-based dye. And this patient with amyloid plaques, the amyloid plaques suck up the sugar-based dye. So it's called Amy-Video or Amy-Vid. It's a radioactive tracer that we use. Okay. Now you can read, just like I can, the different things on your page, so you kind of know roughly what this is. And we're going into much greater detail in an actual lecture setting. But what's important for you to know is the stages of Alzheimer's. Those are very, very, very important for you to know. So in mild Alzheimer's, and that's how I would separate it. I would say mild or early, moderate, and then I would say severe or late. Use both terms. So early or early or, what did I say, mild? Okay, so if you think of mild Alzheimer's, this patient is frustrated whenever they have to learn new things. They're frustrated whenever they have to learn new things. It begins 15, 20 years earlier, generally decades earlier. Half of all patients over age 85 will have Alzheimer's. Half of all patients after age 85 will have Alzheimer's. It's the 6th leading cause of death in America. It is the #1 reason for bankruptcy because it's financially depleting of all your resources. It kills more than breast cancer and prostate cancer combined. The mild form has memory lapses of recent conversations, events, and appointments. Memory lapses of recent conversations, events, or appointments. An inability to make decisions and becoming overwhelmed when you're told to do so. An inability to make decisions and becoming overwhelmed. So Papa used to say, "What do you think, Barb?" And he's never delegated in his life. He's a patriarchal guy. He's in charge, H&IC. And he started doing this whole, "What do you think, Barb?" She said, "What do you mean, what do I think?" And it threw her off a little bit because she always looked up to him to make the decisions. "Well, I just want to know what he thought." "Oh, well, I guess I think that we could go and do it." Okay, so she kind of had to jump into that role, and they are very traditional in my family. The woman does the kids, stays home, cook, and the guy's provider, protector, and the he-man, the hero. And that was weird. "What do you think, Barb?" "Oh, I don't know." Okay, so she wasn't trying to hear that. And she's like, "Look, Bill, you always make the decisions." Okay, so it was a little weird to see that, but that's what they're going to do. They're going to be overwhelmed if you make them make the decision. Okay, make sure you know depression. They're not stupid. This patient knows that they are not quite right, and it is driving them crazy and subsequently causing depression because something just ain't right. It's very sad to see a realization that this is not going the way they wanted to go. Asking the same thing every day, all day, like, what day is it? What day is it? What day is it again? Say which that day was. And this is like 5 minutes apart. That's how repeated questions are. So finally I left. My sister, she puts this big sign on the kitchen table. "Today is blah, blah, blah." She didn't care. "Then, honey, what day is it?" Oh yeah, this is very mild. Yeah, this is very mild. Because in a minute they don't care what day it is. It's like, one day is into the next, right? So this is all still mild. Mild is huge. Because what I say, 20 years. 20 years it's going to take for you to kind of figure out something right here. Okay? So repeating themselves over and over again. So the girls used to say, "Watch," he's going to say, "This is really, really good," every time we give dinner. Like I bring dinner over, "This is really, really good." Then one day he said to Mama, and her feelings were so hurt she cried for days, "I waited all these hours for this shit." He's always said, "This is really, really good." So she was so hurt. I said, "Mom, no. He had chemo and radiation. He does not taste your food anymore." "Oh, well, he didn't have to hurt me like that. I've always cooked for him." Oh, so sad. So you want to remember that the family is looking at this going, okay, yeah, I can appreciate this is an illness, but it hurt my feelings. Remember that. It still hurts because you're human. Okay, that we all get it. This is not him, but it still hurts. So you got to remember that on these issues in the mild stage. Because when it's mild, you're like, you know better than to say something like that to me on your life. Okay, which is what she said. Okay, misplacing items, getting lost. So we got that first call. I don't know where he went. He got in the truck and just left. And he ain't been back since. I'm like, for real? He was lost. Lost. Got a little lost there. And it was the first time, so we were like, oh no, this is not good. So what does that mean? He probably is not going to be able to drive, right? So that's how you know you're moving into moderate. Because now, we're not just getting lost, we're wandering. We're wandering off. We're disoriented regarding the time of the day and even the season. We're wearing shorts and there's snow outside and we're taking the trash out in shorts. 10 degrees out. That's why you get those patients like that. They're completely out of the season even. There's no orientation to the season, much less the day. They now can't tell you their phone number. And they are taking part in this. What in the world is this? What is confabulation? Make it up shit. You just gonna make it up, huh? You just gonna make it up. So fill it in the blanks with stories. And I mean, there'd be some fabulous stories. You're like, Papa, what you say? I don't think so now. Okay. So now we're definitely wandering, getting lost, losing address, don't know the number. I think we really were scared when Papa came home, and Papa has a big wad of money in the broccoli clip, like the mafia, you know, the broccoli rubber band, right? Mm-hmm. He always has big wad of money, huge money. And we were like, he cannot keep taking money out of here. One day he's back and he's not gonna have all that money. And he did. He never knew it. He has no idea where it went, where he spent it on, or if he even spent it. And then it's poor, very poor judgment. He decided to buy a navigator. Just out of the blue. I want a new truck, he says. And because he's the he-man, Mama says, you can't buy a new truck. You don't want a new truck. You got the other truck. You got a bunch of trucks. You don't want a new truck. And I said, I want a new truck, and Dad, I'm getting one. And that's what he did. Stuck it in the garage. She won't let it go. For 5 years, 7 now, she will not let that truck go. Just sitting there to remind her again. So big ass navigator, drove it twice. Paid cash, whatever. Okay, so that is the moderate, right? Now let's do severe. I think you know where we're going. We are incontinent. We have muscle rigidity. We are unable to do ADLs. No talking, no walking. Fetal position. Pneumonia and UTIs. Dysphagia. Put a star by that one. Dysphagia. I would think that we all know what to do with mild, and we probably know a good bit of what to do with moderate. I think your biggest issue is what to do with severe. Severe aromatherapy, music. Who's seen the video where the lady comes in? I think it was a social worker, I can't remember who it was, might have been a nurse. Comes in every single day and sings a beautiful song and plays it.
Yeah,
oh my God. So this nurse or social worker is singing the song in in this stage, the severe late stage of Alzheimer's, to this patient who's pretty stiff, barely sitting up in the chair, kind of out of it, has no concept of anything, so we think, but she keeps singing the same song. And about, I don't know how many weeks later, the patient begins singing the song back to her. Just know they hear you. They hear you, don't write them off. Okay? So this patient needs music and talking and loving and touching and aromatherapy and thirsty blankets and towels and soft teddy bears, and it's all about what? Senses. The 5 senses. Smell, touch, sight, hearing, smells, taste. Okay? So remember, wake up the 5 senses. Okay? That's what you're doing in this stage. And you are protecting them because abuse and rape and everything else has happened to these patients. Everything else has happened to these patients. Especially molestation, guys. Do not underestimate the ability of the staff at your facility to rape patients that are out of it. Happens more often than you know. In fact, you may or may not remember that the young man who was in a coma for 14 years and came out, literally just came out. He wrote a book about it, and his book included the fact that there was never a time when he spent a day in any institution, and I think he had about 10 different institutions he stayed in, that the roommate next to him was not raped or sexually molested in some way. And I think what's even sadder is what he didn't write, which said it probably happened to him, because he was the one in the coma. But he could tell these things were going on, because again, in a coma you can hear everything. And remember what God does. When one sense is faded, the other one is sharper. So your ears are sharper. Okay? Okay. Now, so that is your Alzheimer's. And the medication for your Alzheimer's is the last page or so. And then, of course, you have pain meds on the back. Now, on the page where you have Aricept, I want you just to write a couple things real quick, and then we'll do a little spiel on pressure ulcers, but we're doing pretty fabulous with that. Okay, for your page that has Aricept on it, let's give you the other medications, and you're just going to write them down. Obviously, they're in the medication packet. Exelon is a transdermal. Ribostigmine is the actual generic, just like Aricept is donepezil. So just write that down. Remember to remove the previous patches, right? Mm-hmm. This is changed every day, by the way. So, you know, you're putting on a new patch every single day. If your patient is drooling, they're overdosed, which is what that patient was doing with their 5 patches on. So I call it the 4 Ds, which equals dizzy. Patient will be dizzy. They'll be drooling. They'll be drowsy, which she said her patient was very loopy. And they'll be diaphoretic when they're overdosed, which means they have all those patches on that some asshole didn't take off. 4 Ds of overdose with Exelon patches. The other medication that we like to use, Razidine is the brand name, and galantamine is the generic. The problem with this medication is weight loss. Now, Aricept, Exelon, Razidine, mild to moderate Alzheimer's. Remember why we give it. It does not prevent Alzheimer's. It doesn't treat Alzheimer's. What it does is it makes the patient able to do their activity of daily living better. It gives them the ability to do the activities of daily living better. Once the patient is in moderate to severe Alzheimer's, and I always say remember it like this, in moderate to severe Alzheimer's, they don't even know their name, right? Namenda. Namenda, of course, is the brand name. Memantine, which I've seen a million times, is the actual generic, memantine. This is moderate to severe Alzheimer's. All of these medications, you have hepatotoxicity as a risk. Hepatotoxicity, so watch the liver. Now, let me give you two more things on plain old-fashioned Aricept, because it's so popular. Never abruptly stop it, or you're going to get rapid deterioration. Never abruptly stop Aricept, or you're going to get rapid deterioration and diarrhea. So watch for diarrhea in all of these patients, right? Because almost everybody's on Aricept. Also, take it in the evening. Okay, cool. Now, I'm not going through the burns completely. We don't do burns today, right? But in the burns packet is your pressure ulcers. And I'm going to tell you, I want you to find the page that shows stages or something. Let me find it. I put the negative wound vac in there. I put all the pictures of that in there. I put your stage 4, 1, 2, 3. I put all that. I put pressure injury prevention. I put all kind of crazy stuff in there, okay? So what I want you to do is find where it says news and analysis. This is the most important page in the packet for what you needed to do. So it looks like that. Always look up and see if you're matching. News and analysis, okay. All right, now, so news and analysis, 1, 2, 3, 4, okay. Now, everything I wrote is already in here. What I need you to do is highlight what I wrote that is in here, okay? Oh, here, I thought you had it over there. You sure? No. Okay. Oh, well, there you go. I forgot about that. Okay, so highlight these, because the words are right in there. Do you see the first one? Does it say unblanchable in that sentence somewhere? Boom. Must be important, huh? Redness and unblanchable. Can you find, and if you don't see the words that I wrote, add my words, right? But see if you can. Stage 2 is like, the skin is broken. What I'm trying to tell you is, with stage 2, the skin has to be broken for you to say it's out of stage 1. So if the skin is broken, it's not in stage 1 anymore. Skin is broken, and maybe it looks like an ulcer to you. Maybe it's already blisters. So this is all stage 2 for ulcer, blisters, and skin is broken. The biggest thing in stage 3 is now you've gone down to injure the subcutaneous tissue. It may even be like a crater, very deep, and there may be tunneling. Stage 4, exposed bone, muscles, tendons. You want to remember that they may not say bones, they may say muscles and tendons. That's stage 4. What is that patient at risk for with bone exposed? Osteomyelitis. Stage 3 and 4 might need a negative wound vac. Stage 3, pressure injury, and stage 4 may need a negative wound bag. They usually need chemical debridement. Chemical debridement with an enzyme or so. All of these patients need high protein, high vitamin C, and zinc. High protein, high vitamin C, and zinc. Unstageable, the wound is covered with slough. Use those, find those words. Slough, debris, eschar, necrotic tissue. I tried to color it what it would look like. So slough would maybe yellowish, blackish, weirdest pussy color. Debris is just gunk and crap in it. Exfoliation is garbage. Eschar is, of course, eschar, necrotic tissue is dead and it's black. Remember what we talked about, black is dead. Black tissue with the sore in the wound is dead tissue. The depth of the wound cannot be determined. That's what unstageable means, and yes, you have to know that. The depth of the wound is unable to be determined. Okay? Okay, babies. So I'm going to